Hi, my name is Danica and I'm going to be demonstrating a knee x-ray today. This knee x-ray is composed of 4 different views. You have the AP, oblique, lateral, and the transgental. Now I'm going to be getting my patient. Hi, Daniel.
Yes.
Hi, can you please give me your full name?
Daniel Robles.
Perfect. And date of birth?
8/15/90.
Perfect. And if you were a woman, I would be asking if he was pregnant, but I'm hoping that he's not. Okay, perfect. So what we're going to do today is, I believe, a knee x-ray. What exactly happened?
I got some knee pain and I fell like 2 weeks ago.
Okay, and is your right knee?
My right knee.
Perfect. Okay, so what I'm going to have you do, Daniel, just to get started, is go ahead and put on this gown, opening in the back, and then we'll start your x-rays.
Okay.
I'm going to go ahead and move my tube out of the way for my patient. Daniel, go ahead and take a step up, and I have a pillow right over there for your head. Perfect. So according to Merrill's, there is a tube angulation anywhere from 3 to 5 degrees cephalic or cotted, depending on the distance between the as-is and the table of the patient. Today we're going to be using 5 degrees, which I already have my tube angulation on. I'm going to make sure that my tube is detented to the table and that I have it aligned with my IR. Once I have aligned everything up, I can go ahead and just move the table. Next, I'm going to be feeling for the apex of my patient's patella. And I'm going to have the central ray entering a 1/2 inch below. Perfect. Next, I'm going to make sure that I have my marker into the image of the light field for the knee. Perfect. Next, I'm going to make sure that I'm shielding my patient. It's going to be a little heavy. And I will go over to my console and I'm going to be setting it at 60 kV to 2 mass. And this is going to be the same for all of my projections today. And x-ray. Next, I'm going to be doing the oblique view. So what I'll have my patient do is just log roll his leg 45 degrees medially, and still I'm going to have the central ray at a 1/2 inch below the apex of the patella. And that looks about right. We're going to go ahead and place my marker. I'll do my exposure, x-ray. Next I'm going to have him I'm going to do the lateral. So I'll take this off of him. Daniel, I'm going to have you lie on your right side. All the way face me. If you can, just scoot back a little bit. And I'm going to have you bring your left leg in front of you. Perfect. I'm going to make sure that his affected knee is going to be angled 20 to 30 degrees. And my central ray is going to be 1 inch distal to the medial epicondyle. Perfect. Daniel, don't move. You're doing great. I'm going to be shielding my patient again. And I'm going to go ahead and leave this at a 5 degree angle, but for a lateral, it can be anywhere from 5 to 7 degrees. Again, 60 at 2, and I'm going to take my x-ray. Perfect. Okay, so now we're going to be doing the PA axial projection. Daniel, I'm going to have you roll over to your back. Just careful of the sides. Next, I'm going to be grabbing these towels to lift Daniel's leg and support it at a 60-degree angle. At this point, I would be having my plate, if I had one small enough, a 10 by 8 here on top, right under his knee. The central ray is going to be entering and 1/2 inch below the patellar surface. And I would place my marker here for his right. The tube angulation is going to be perpendicular to the long axial of his lower leg. At this point, I'd go back to my center console. I would put in 75 at 5 for this projection. The other ones I did mention earlier were at 60 at 2. Those are actually for outside tabletop. Since it was in the Bucky, I would have changed it to 75 at 8. And I would be exposing at this point. Next, I am going to have my patient sit up once I move these towels out of his way. Thank you. Daniel, please be careful with that right above you, but I'm going to have you sit up completely, and I'm going to put this as a back support. You feel good right there? You can lean back a little bit. I'm going to hand this to you now, and I'll tell you exactly what to do with it in a second. Next, I'm going to be doing the Setagast projection, which is also known as the sunrise. There's going to be a 15 to 20 tube angulation cephalic. Okay. Next, Daniel, I'm just going to have you hold the plate right about here. Thank you. Okay. And as far as my entry point for this projection, it's going to be at the patellofemoral joint is where I'm going to be angling. And again, this is going to be 75 at 5. I'll go ahead and go to my console and make my exposure. And Daniel, you are all done with all of your knee projections. Thank you.